Good morning and welcome to another edition of Inside Sources. I'm Greg Sortis, and today I'm alongside Maura Carabello, who joined me last week.
Yeah,
Thanks
it's nice
for
to be back.
being here again.
2 weeks in a row.
There you go. And we had fun last week, and I think we have an interesting program today, except you started me on a bad note today because we started talking about candies that really haunted us. And so now I've got circus peanuts and candy corn in my
Well, you just wait. We're going to do more of this.
Yeah,
We're going to do
so
a deep dive
I'm
into...
starting the morning green a little bit today. Speaking of green, did you ever have the measles?
You know, I didn't, but measles hits home with me. I'll start this segment out with a personal story. My oldest brother, the first kid in our family, was born in 1964. The reason that date is interesting is it's the year that the measles vaccine came out.
Okay.
So my mom was pregnant prior to the measles coming out. She had the German measles for one day during her pregnancy. She didn't even feel very sick. She went on. My brother is profoundly disabled because she had the measles when he was born. He has lived. They said he wouldn't live to be 2. Then they said he wouldn't live to be 12. He's
60 something.
He just turned 60, but he is really profoundly disabled.
Wow.
We're lucky to have a family that helps us care for him. So the measles had an impact when my mom was pregnant with my brother.
I had no idea. So I was born in 57, so in 64, I think we all got the MMR shot.
That's
measles,
right, yeah.
mumps, and
And
rubella.
rubella.
And that's why a lot of us were spared the measles. However, measles have been on the rise in southern Utah. Some officials are worried that it's going to get worse. Apparently, we've had 53 new cases in Utah since the start of the year. One on a vaccinated person. The other 52 were unvaccinated. So that tells you what you need to know about vaccinations. Although there is some pushback to that. Let's talk with the Director of Communications of the Salt Lake County Health Department, Nicholas Rupp, who's joining us this morning. Nicholas, thank you so much for joining us.
Absolutely. Thank you for having me.
So tell us what's going on right now in the state of Utah as it relates to measles, and is there reason to be worried?
So as you said, we have 53 cases statewide as of yesterday, most of them in the southwest corner of the state. And if you are unvaccinated, yes, you should be a little worried because we expect we will have additional cases among unvaccinated people. If you are up to date and vaccinated with your MMR, you really don't need to worry because the MMR vaccine is incredibly effective, 97% effective at preventing infection, and very safe as well. So if you're not vaccinated, get vaccinated. That's the message.
Does the protection happen right away? You go into your doctor, you get your MMR vaccine, and within the next week you have a level of protection?
You do have a level of protection within a week, and you're considered fully protected after 2 weeks. It takes your body about 2 weeks to fully build that immunity from the vaccine.
So when you say it's more prevalent in the southwest corner of the state, you're talking about like Washington, Iron counties, St. George, that area?
Yes, the Southwest Utah Public Health District. It's 5-county district in that southwestern quadrant of the state.
Do you have any reason why that would be particularly? I mean, I guess I might have expected the southeast corner, but not that portion of the state.
So the Southwest Public Health District does have a slightly lower MMR vaccination rate than many other areas of the state. And as you said, we are seeing the spread almost entirely within unvaccinated people. So that's likely why that's the area of the state that is experiencing more illness.
So, Nicholas, can you help me compare this year over year? Is this so? Maybe I'm just reading the news more about this year, but I feel like this is sort of big, scary a little bit. And I'm thinking, holy cow, I thought we had wrapped our arms around measles, and this 53 cases feels big to me. Is historically this big? Is this on average? Is this higher than normal for this time of year?
This is not normal at all. You're absolutely right. This is big. This is bad. This is kind of unprecedented in Utah. This is an illness that we declared eradicated domestically 25 years ago. When I started working in public health 15 years ago, we did not worry about measles being in the United States. It didn't exist. The only time we worried about measles was when someone traveled internationally to an area of the world where it had not been eradicated and they were unvaccinated. They might bring it home. So that's when public health was worried. But now we're seeing it spread locally. We're seeing it spread domestically in the United States. And again, almost entirely among unvaccinated people. So a decrease in MMR rates over the last 10 to 15 years has really led to measles getting a foothold again in our country.
Were you here at the beginning of the segment, Nicholas, when Maura was telling us about her own personal experience with her family? And is that something that gives us a reason why this vaccination is so important?
Yes, absolutely. Tragically, 1 in 5 unvaccinated people who get measles will end up hospitalized. 1 in 20 unvaccinated children who get measles will end up with pneumonia, and 1 in 1,000 children will develop encephalitis, which is swelling of the brain, and that's what can lead to intellectual disabilities or leave a child deaf. And about 1 to 3 of every 1,000 unvaccinated children with measles will pass away.
So
really tragic.
What? How do I know I have the measles? If what are the symptoms? What are the signs?
So the first symptom of measles is usually very flu-like, cold-like. You'll have a fever, a cough, runny nose. And then something that's a little unique with measles is you'll have red, watery eyes or conjunctivitis. 2 to 3 days after those symptoms begin, you may get tiny white spots inside your mouth. And 3 to 5 days after those initial cold-like symptoms, you'll get that telltale measles rash, those flat red spots. They generally start on the face at the hairline and then spread down the body. So you don't always know you have measles until that telltale rash on day 3 to 5. And so those cold-like symptoms for those first 2 to 3 days, you are still infectious. That's one reason that measles is so dangerous, is that you think you have a little head cold and you really have measles and you're out infecting people, exposing people. And measles is extraordinarily contagious. It is one of the most contagious illnesses we know.
And so the carrier can be infectious for, even a week, spreading these germs before they might fully know what's going on.
Absolutely, absolutely. That's why if you have symptoms of illness at all, please stay home. If you think you just have a head cold, stay home. We don't want to infect anybody with anything, but especially not with something as serious as measles.
Nicholas, we've got about a minute left, but I just had my 5th or 6th COVID shot and my umpteenth flu shot, but I think I only had 1 MMR shot. Is it something that an individual my age, and I'm on Social Security, it should revisit again, or is it something that you'd expect to last a lifetime?
So if you were vaccinated after 1967, 1 dose as an adult is sufficient. If you were vaccinated with the early version of the MMR from 1964 to 1967, you do need an updated dose in modern times. Children should have 2 MMRs, 1 at 12 months and 1 at 4 to 6 years. So it kind of depends on your age, but generally speaking, if you're an adult and you've had 1 measles vaccine in relatively recent years, you're fine.
Nicholas, we only have 1 minute. We have just a quick, tell me where the best place I should go if I'm interested in getting an MMR vaccine.
So Salt Lake County Health Department immunization clinics have plenty of MMR in stock. We're at saltlakehealth.org/EMS. You'll see all our locations. We will bill your insurance. And then MMR is available at pretty much every pharmacy and doctor's office in the state. It is widely available.
Thanks for talking to us. That was Nicholas Rupp, Director of Communications for the Salt Lake County Health Department. Great local segment to kick off. But Greg, we're going to take advantage, as always, that you are not only a great host, but you have a great legal mind. Next segment, we're going to jump into the Supreme Court here,
which just started its session. We'll be right back.